Hello, and welcome to AFD TV. I'm your host, Savita, and today we're going to talk about the Affordable Care Act, or the ACA.
Perfect. Thank you, Savita. And we're here with David with Cornerstone Insurance. So, it's been great education for me because it's an alphabet soup out there. So I got my cheat sheet here.
Great.
So what is the ACA?
All right, so the ACA, the Affordable Care Act, aka Obamacare, was actually a law that was passed back in 2010, way back 4 years ago. Most people really didn't start paying attention to it, though, until January of last year when the whole individual health marketplace. But it's actually been in place for 4 years, and there have been a lot of changes that are being phased in over the last 4 years that affect really everybody who has health insurance.
Wonderful. So is everyone required to have health insurance now?
Yep, one of the provisions in the Affordable Care Act is that everyone is now required to have health insurance. And you can either have health insurance through your employer, which the majority of Americans have health insurance through an employer, or through a government payer, such as Medicare or Medicaid, and then as well as the individual insurance. So if you don't get your insurance through an employer or through a government plan, you're required now to purchase an individual policy.
Okay, and now say if I'm an individual and I'm not purchasing it, how much is my penalty in 2015 for not purchasing?
In 2015, it's going to be 2%, up to 2% of your adjusted gross income. So the penalties are getting a little stiffer.
Oh, okay. So,
and I think it's a minimum of $700 and something dollars.
And that's up quite a bit.
300 and it's a minimum of 300 and something this year.
So
yeah,
it's
and it goes up again next year. Yeah, it's up. It's more expensive not to have it this year.
Got it. Yeah, and it'll be based on your 2014 income then?
No, it's going to be based on your 2015 income.
Oh, so you pay the penalty after the fact.
Right, you pay the penalty after you file your taxes because they're going to look at how many months throughout the year you had or didn't have coverage, and they'll prorate the penalty based on that.
Are you getting all this? There's going to be a quiz at the end. Okay. Can I get a plan whenever I want?
No. Actually, because of some changes that they've made in the fact that all plans now are guaranteed issue, meaning they can't exclude conditions or ask any health questions, they have to close the enrollment period. Otherwise, people would wait till the day they get sick to buy insurance. So this year, for 2015 open enrollment, it goes through February the 15th. So you have until February the 15th to buy a plan that will take effect on March the 1st.
Got it. And when did that enrollment period start?
The enrollment period started on November 15th. So this year it was from November 15th through February 15th.
Got it.
So if you enroll by January 15th, your plan will take effect February 1st. If you enroll by February 15th, your plan will take effect March 1st.
Got it. And so say if somebody is young, healthy, trying to wing it, and you said February 15th is the last date?
Right.
Okay. And then if they get sick on February 1st, then they can go ahead and buy insurance on February 2nd?
They can, but it won't take effect until March 1st.
Got it.
Because after the 15th of January,
yeah,
after the 15th of January, you can no longer get a February 1st effective date.
So, and what if somebody enrolls but doesn't pay their premium?
Right, that's a very good question. In order for a plan to take effect, when you enroll in a plan, you are required to make your first month's premium payment before the first day that plan takes effect. So for example, if you have a February 1st effective date, you have to have your payment in by January 31st or the plan will cancel.
Got it. And are people choosing a lot of times plans without premiums?
It really depends. It depends. There's a lot into that. I think we're going to go into that here in a minute on how you select a plan.
Sure.
But a lot of that's going to depend on, number one, whether zero premium is even available to you.
Got it.
And number two, if that fits the kind of coverage you really need.
So whether you have lots of medical conditions or not,
right,
it's the same price for everyone.
Yes, based on the price now on ACA plans or individual health insurance is only a factor of your age.
Okay.
And the county you live in.
Okay.
Whether you smoke or not, and the level of coverage you choose.
Got it. That makes sense.
So there's no more male and female. You don't get penalized for being a woman anymore.
Got it.
Really, the only thing that factors into your premium is your age and whether you smoke or not.
Do you have to prove if you're a smoker? Is there any test?
No, not yet. I'm trying to figure out how many people are really being honest, and we'll see where that goes. But as far as I know, no saliva swabs or anything like that. So
it's been an issue for us because we'll have patients who have smoking cessation programs at work, but they won't go through it because they don't want to tell their employer that they smoke.
That's right.
Yeah, well, very good. So, well, I think, is that anything else you can think of?
I think for ACA intro, that's a pretty good start.
Yeah, I know we could talk forever.
We
Okay,
can talk forever. It gets complicated.
take it away.
Thank you for watching AFD TV. See you next time.
Bye.
AFD TV is designed to provide an educational discussion about current medical topics. For a personalized medical opinion, please consult your primary care physician or visit one of America's family doctors' clinics today.